Thanks very much, Catherine, and delighted to be able to talk to you today about the strategy. If you haven't heard from me before, I'll just give a very brief overview of how we went about it and what it's all about, and then just some of our plans for the future. So I'll try and be as brief as I possibly can. So I suppose the first thing is, why did we decide to do a children's nursing strategy? What was the impetus for us? And really it started off with conversations when the Senior Children's Nursing Network was formed way back in about 2014. There was a lot of change happening in children's healthcare service provision, such as the new model of care, the plans for the new hospital. There's a lot of changes going on in the Department of Health with advanced practice, safe staffing frameworks, a lot of new nursing policy, affirmation of our values. And then more recently, we've had Sláinte Care, which currently our children's health service provision is very much an acute-based service, whereas Sláinte Care is all about care closer to home. So we have plans with the model of care for that, to have care closer to home with through managed clinical networks and integration of care and services. And then last year, HICWA had started work on developing overarching standards for the care of children in health and social care. So there was a lot of things that sort of questioned where the role of the children's nurse is. We are the only group of professionals that to practice or to register as a children's nurse now in Ireland. You either are qualifying as a dual qualified RGN or RCN, or you undertake your postgraduate following an undergraduate registration on one of the disciplines in NIMBY. So we have a lot to offer having that double qualification. So it was a good starting point. So when we started the project, which started at the beginning of the early 2019, but COVID had a big impact. What we tried to do was really look at this strategy from the point of view of the children, try and see what the children and their families need, and then secondly, what do the nurses need, the children's nurses and other nurses, to deliver and meet the needs of the children and their families. As I said, COVID had a big impact. It slowed the process down. It slowed our scoping review. So traditionally, when you would do a project like this, you'd have your scoping review to inform your consultation. But because of COVID, we had good ideas of what was coming out in our literature, but we didn't have the final document. So these ran in parallel, our consultation and our scoping review. In all, we consulted with over 1,000 people, and that included staff nurses, nurse managers, AMPs across the spectrum, public health nurses, intellectual disability nurses, psychiatric nurses. We had written submissions from 48 different organisations, including the INMO, from various groups, advocacy groups. We conducted 8 expert informant interviews, and these included 4 people within Ireland in senior roles that had a direct influence on the care or education of children's nurses or on the care of children, and then 4 international colleagues, and they included 2 chief directors of nursing and 2 professors in children's nursing. We asked one of our university colleagues to analyse all the data, because we had the combination of lots of conversations, the results of workshops, surveys, written submissions, and the expert informant interviews. So we wanted the data analysis to be as robust as possible. This was consultation, so we didn't require ethics. However, we did consult with 10 children from the Youth Advisory Council, and we didn't apply for ethics, but what we did try to do was apply the Lundy model of participation, and we obviously gained the children's assent and the parents' consent, and the children were informed that if they wished to withdraw from participation, they could do. We held, I'll just tell you a little bit about this, because I was talking to the members of YAC this week. What we did was we met them, and then we asked them what would they like to do. We told them what we were trying to do. We were looking at a strategy for nursing and what did they want from children's nurses going forward. And they decided that we would do work together on a graffiti board. So the children themselves, we spent a few hours they spent a few hours drawing and giving messages for nurses, which is at this poster. This is a few quotes from the poster, but we have a 20-foot poster with about 55 messages from children about what they wanted from children's nursing, and you'll find that in the document. But it was mostly around compassion, listening, and being expert skills and skilled. So there's just some of their quotes. We're more than just a job. We have feelings. Engage more. Be aware that we might be afraid, and to realize that this might experience might be remembered for some for the rest of their life. And communication is key. So just to go through some of the key findings, well, we found that children's nursing can play a significant role in advancing health and well-being. And particularly, I suppose, not to say that all the other grades or all other roles aren't really important, but from a service level, when you look at the entire service, community, through social services, etc., AMPs can play a huge role, and that's particularly in relation to chronic illness. The other thing that we found was that the role of the nurse on the ward, particularly as a mentor and a preceptor, and as support, being the need for those people to support all of our student nurses, that role was really important as the foundation from which everything else in the profession. So when you have everything right at the patient level, then everything that forms the foundation, and from that then we can develop all our roles, our managers, our research, etc. So that was a really important finding. We also found, and this came not just from the literature, but from talking at workshops and from the surveys, the care on the ground, particularly in the acute services, is extremely complex now. What would have been deemed HDU or even ICU when I would have started in ICU many years ago, you now find children out in the wards with TPN, chest drains and non-invasive ventilation. And indeed, these children are living extraordinary lives at home, assisted by all this technology. So we have found that our early career nurses will need skills in delivering high dependency care. We found, particularly there was a little bit of a divide for education pathways, because it's very hard to access children's nurse education, particularly the postgraduate programme if you live outside Dublin, or if you come from abroad and there's a different education system where you may have modules or even masters in children's care, you may not access the RCN. So there's we found a lot of discrepancies there and a lot of room for us to look at new ways of looking at our education pathways. We also found that the need for interdisciplinary working across and education and collaboration, because there are lots of things where we're very much in our silos. So the example I sort of give to people is, if a child breaks their leg and has a bad wound, they need a physio and a nurse, but there may come at a stage where either a physio or a nurse could do the role of the other, and there you have a way of cutting down a child maybe seeing two people when one could do it. So that's just a very simple example of what we're trying to say. We found a lot, particularly in the workshops, a lot of highlighting of the issues that children and their families are encountering every day, mental health issues, and supporting the services, even basic parenting skills and understanding when is the right time to bring a child to an ED, even understanding child development and families maybe not having that support out in the community that they need, and the need for care closer to home. What really was striking was the need for the role of the children's nurse as a leader. And when I speak about leader, I'm talking leadership. I'm not talking about seniority. We're talking about influencing each other, influencing children. We have a lot of issues with children in Ireland. 20% are obese, number of huge mental health issues, rising chronic illness. About 16% of children have a chronic illness. That's a lot of children. So we need to be influencing them very early in their life to manage their illness and empowering them to look after themselves. So as they advance into those tricky years in adolescence and later adolescence, that they have good habits in managing their health. So as they transition into the adult services, they're able to manage, because we all know many children and young people transition into the services and they may not may not manage their health as well. That cohort of 18 to about 25, some of their outcomes for some serious illnesses are not as good as if they were diagnosed when they were younger or when they were older. We also found out the need that we need to raise the awareness of the role of the children's nurse, and also what it takes to look after the children and what kind of competencies and skills, because there is a little bit of lack of understanding of that, and also around our philosophy and what child and family centred care, so that if there are units that are placed in, for example, regional hospitals, that there's an understanding that, for example, a child that's admitted in acute asthma, that may take two nurses, one to manage the family. The child may be repeatedly having their nebulizers changed or their medications, and they need a lot of intense nursing for maybe 24 hours. And then that child could be discharged maybe after 48 hours. And unless you work in the world of children's, you may not understand that acute need might need more staff and less staff the next day. And we also found a lot about the need for digital transformation, which has happened in our own personal lives, and we now need to transfer that into the healthcare. So when you look at a strategy, just to explain, maybe if anybody hasn't worked out why we have certain things in the document, and you can access the document online if you go onto the ONMSD website, and you should have hard copies in all your units. So when you look at a strategy, there's kind of some key things that you have to look at, and this is what we try to do. One is you have to have a vision. So a vision really is, it's an aspiration of what you want to be, what way you think would be the best way for children's nurses to work, and the environment maybe in which they could work. Your mission or your purpose is, it's about the core of what you do. Then you try to identify the strategic priorities that are achievable, and then you try to look more deeply or specifically into objectives which are specific and tangible, and then you develop an action plan. If you have a look at our document, that's the way we framed it. And then within that, you have to look at, have you got the right governance and enablers to get to where you want to go? So that's where we're at the moment, trying to work out, have we got everything we need to get to where we want to go? So that's our implementation. So we identified a vision, you leading the way. So it was all about leadership, and we had specific ways in which we thought we could do this for the future. And I'm going to go swiftly through these. So child and family centered care, well-being, getting out there, sharing what we know, partnerships and networks, supporting integrated care, embodying equality, diversity and inclusion, really, really important. Even just listening to Orla, for our autistic children, for our LGBTQIs, our immigrant children, our homeless children that interact with our services, the importance for our values, that really shone through. Again, new ways of working. And then obviously we're a profession, so we must pursue excellence. Our mission is about delivering outstanding child and family centered care and making a positive impact. This mission came out of all of the survey and the notes from the workshop. It became very clear what we all thought we were about. And then we also identified our values, or our behaviours that are associated with our values: care, compassion and commitment. We were able to extract between YAC and some of our workshops what behaviours children's nurses have that reflect our values, and you can see that that's in the fold out section of the document. And just to give you a lovely quote from Dr. Colm Henry at our launch in July, described children's nursing as a unique fusion of knowledge, expertise, professionalism combined with compassion and empathy, and it's uniquely poignant and unashamedly compassionate and bonding. And I thought that was really nice and really reflected some of our findings. So our strategic priorities are fostering innovative and adaptive leadership and workforce planning. We're nothing unless we have our workforce. Advocating as a voice of influence in the care of children. So that's just more than child and family centered care. It's about embodying the children's rights and participation, feedback, and stepping up into a place that maybe we haven't done before, and advocating for the children at a very senior level. So just to give an example, we have been lobbying a lot recently to through HICWA to ensure to encourage them to include children in their patient experience. So their children aren't included at the moment, so we have been lobbying from the Senior Children's Nursing Network. And then the last thing is, we won't be a profession without our education research and the pathways for that. And we need to bring other nurses who maybe care for children but don't have their RCN. We need to give them pathways to develop the knowledge, skills and competencies so they can care for children appropriately. So I'm not going to go into each of the actions, but if you go through the document, you'll find a lot of actions outlined under all of our objectives. How we plan to implement the strategy is this group called the Senior Children's Nursing Network, which was formed originally with assistant directors of nursing and senior grades, but now we are going to extend that bit slowly but surely. We'll start to extend it out towards the other grades in nursing, and we're trying to bring the umbrella of all our children's nursing under this umbrella. We hope we'll develop a website, and we're going to use this as the vehicle to implement the children's nursing strategy. So we have some of a pathway that we're trying to look at. So one of them is we agreed that the network would be the vehicle to implement. We've got some funding from the ONMSD for the SCNN to maybe run webinars and workshops to so that we can develop plans of how we'll do it. One of the first things that we've done is we've tried to bring our AMPs together as a national group. They came together, which is fantastic, and they've initiated their RAMP grand rounds, which are on the first Wednesday of every month at 1 p.m. and we send out the link nationally. It's going to be recorded from the next meeting onwards, so you'll have a chance to view it afterwards if you don't get to see it. There are plans in place for a strategy implementation lead from my role finishes in December. So there are plans in place for a lead person for 5 years starting in the new year. And then we're going to start looking at all of our various groups and trying to bring it together to look at the various plans and ways that we can implement the strategy. So as I mentioned, pushing the patient experience piece, our CNSs, looking at our Centre for Nurse Education, they're developing their strategies. Some of the work that our Chief Director of Nursing in Children's Health Ireland is doing is talking with the department and the HSE on how we can look at pathways and maybe meeting with NIMBY to see what we can do with that. So there's lots of plans. It's a 10-year strategy, so it's going to take time. And we look forward to engaging with everyone. This is everybody's strategy. And I suppose the most important thing to say is that 50% of the people that consulted with me in the strategy or with us were staff nurses. So this is your strategy, and get involved. If you see something from the SCNN, get involved, pass on your ideas, your thoughts through your nurse managers, because we will get a communication strategy going where we hope that every ward will be able to feed right up through the SCNN into what we hope to establish in the new year, a national advisory group for the implementation. So that will be one of the first things hopefully to be done in the new year. And we want to be able to have a communication strategy from that advisory group all the way down to the bedside and back up again, so that we are working on implementing the strategy together.